Do you take PPI medication? For those of you who don't, it stands for proton pump inhibitor, and that is a medication that is a prescription antacid. So in this channel, we spend a lot of time talking about hiatal hernia syndrome, and one of the initial symptoms that begins the whole process is acid reflux. And after the over-the-counter type medications that most people start with no longer work, then they graduate into what's called a PPI. And there's over 110 million of these prescriptions written every single year here in the United States. So it is a very commonly prescribed medication, but it is not without its dangers. And an interesting study going back to 2014, it was published in the International Journal of Cardiology. And what these researchers wanted to look at was the risk of myocardial infarction. So the risk of having a heart attack in individuals who had no prior heart attack. So they didn't have a history of this, but because PPIs have a link to increasing your risk of having a heart attack, they wanted to get a nice robust group of people and compare PPI users to PPI non-users, and the users again did not have a history of having a heart attack. This was done in Taiwan, and they followed patients for the patient population, I should say, was followed for 9 years, from the year 2000 to 2009, and they had over 126,000 in each group. So the PPI users, the non-PPI users, with both of them never having a history of having a heart attack. And they did 2 different types of studies to verify the results, and the risk was anywhere from 1.5 times to 3.5 times increased risk of having a myocardial infarction, a heart attack, when taking a PPI versus not taking a PPI. So this is obviously concerning, not something most patients are warned about, yet the evidence keeps mounting. And here at Root Cause, where we treat patients with hiatal hernia syndrome, what we do is get to the reason why they're on the PPI, why is the acid in their stomach being suppressed, and the reason why is because the stomach is sort of acting inappropriately, it is deemed, because the acid is going up the esophagus and creating heartburn and that type of distress. Now that makes sense until you realize that it doesn't. So why doesn't it? Because the stomach is supposed to be a bag of acid. That is it doing its job. Now it is inappropriate, true, for the stomach to have to be compressed in such a fashion that its juices, its acid, goes up the esophagus, creating acid reflux, and then needing that to be suppressed with the medication. So what's wrong is this pressure that's being put on the stomach, such that just like a balloon full of water where you haven't tied off the neck, the pressure results in the contents squirting up the esophagus, giving somebody heartburn, acid reflux. So that's the part that's inappropriate. It's not that the stomach is inappropriately producing acid or producing too much acid. That is not the problem. So we come in with these medications to suppress acid production, and there are a number of different side effects, and I'm really sort of banging the drum on this right now. I've talked about it before, but obviously not everybody sees every single video, and there are just too many people on these medications not knowing the dangers and not knowing the side effects. So there are a number of different side effects, so I'm going to be doing videos on each and every one so we can do a bit of a deep dive into this. The link, by the way, and I'll probably do a separate video on this as well, but the link has to do with the fact that these drugs, the PPIs, lower your ability to make nitric oxide. And what nitric oxide does is it keeps your vessels dilated, keeps your blood pressure down, it prevents clots from forming in the arteries. So absolutely, nitric oxide does a lot of different things, but it's absolutely critical for cardiovascular health. And unfortunately, these PPIs kind of annihilate through a chemical process your nitric oxide. So that's where this increased risk is likely coming from. So I hope that you will share this with people that you know who are taking PPIs. Even somebody who right now just kind of lives on Tums the way some people do, because inevitably they're going to be going in that direction. And we need to appreciate the fact that the stomach, again, is not misbehaving by making acid. What the pressure on the stomach is what we identify the reason it is happening. And when you identify the root cause, the reason the stomach is being compressed, then you handle that. The stomach is no longer being compressed, and therefore it's no longer bringing its acid up the esophagus. It's pretty easy, actually. It's just a matter of understanding, because I can hear your question right now. What do I do? What do I do? And it's a great question. It's just that the answer is very, very different for each individual. Now, there's not a million different answers, but there's probably 10 to 15 different reasons why your stomach can get compressed like that. And that's what we do here, is we get to that root cause reason, or reasons, plural, right? There can be a few different factors that are affecting, calling this increased intra-abdominal pressure in the abdomen, in the body. And that's what we tease out. What is it for you, and what is it for Bob, and what is it for Mary? Because it's different, and that's why our programs are very personalized and customized. So I hope that makes sense. I hope you will take heed if you're taking a PPI. I'm not saying just to stop your PPI, because that comes with its own host of issues. So, well, of course, we'd love to help you here, really get to the root cause, because if you tell your doctor you just want to get off the PPI, they'll just suggest a different medication, and that's not really the answer. We want to get to the real root cause of why it's happening, so you don't need any medication. So that's the goal. By the way, if you enjoyed this video, please subscribe to the channel. We're trying to have more people view these videos, so more people can get educated, and the more subscribers you have, the more likely the videos can get viewed, because I really, really am here to help. My whole team is committed to this, and it's just too many people suffering with hiatal hernia syndrome needlessly, and having these untoward effects of drugs that they think is their only solution. Most people are told it's PPI or surgery, and then sometimes people get surgery and they're back on the PPI, so the surgery doesn't have long-term benefits. So yes, so if you like the video, give it a thumbs up, please share it with others, and I look forward to talking to you soon.